Minimal pairs are used in therapy so children can differentiate meanings between phonemic contrasts when speaking, which demonstrates a linguistic aspect in treatment. This type of treatment must incorporate a word list that is meaningful to the child and allows the child to listen to the individual differences of the minimal pair sounds. Treatment with a word list of 50 core vocabulary words that are functionally powerful for the child will improve the ability to form or access phonological plans. Thus, treatment of this video incorporates a word list used in the child's environment that differentiates by minimal pairs. A child with semantic limitations related to the child's inability to comprehend and/or use the sound system of a language and the rules that govern the sound combinations would benefit most from treatment procedures used in the video. The client should also display normal cognition and be between 4 to 6 years of age. These children are typically highly unintelligible, have multiple phoneme errors, and phonological processes can be used to describe their speech sound changes. Children that fit this profile are labeled as having a phonological disorder with impaired semantics due to comprehension difficulties of the sounds in their language. Assessment procedures include case history and interview, audiological testing, oral motor exam, articulation tests such as the Goldman-Fristow, phonological tests such as the Kahn-Lewis, stimulability testing, contextual testing, speech sound discrimination testing, measures of intelligibility and severity, connected speech language sample, and voice fluency language and literacy screenings. We can collect baseline data from the standard scores from the initial formal test, in this case the Kahn-Lewis. Baseline data could also be collected from the first session that you target skills from a measurable goal. The words in the minimal pair list should contain words the child already knows and new ones to learn. The words should also be a part of their natural environment and be useful to the child. This approach uses minimal pairs to expand vocabulary. Using minimal pairs, we are building off of what the child already knows when introducing a new word. It is easier for the child to say the new word if they already know the foundations of a similar word. This method can be used with both nouns and verbs to expand the child's language abilities. By having the child use the new words in a sentence, we are relating the minimal pairs to vocabulary development. The goal is for the child to be able to appropriately use these words as a part of their everyday language. This treatment strategy supports their phonological skills and increases their vocabulary skills. Create a list of words containing minimal pairs. Minimal pairs should contain one word the child already knows and one to add to their inventory. Present minimal pairs to the child. For example, tea and key and dough and go. Once the minimal pairs have been presented, tell the child the meaning using visuals or manipulatives. For example, an actual key or Play-Doh. Have the child show you the words. You may want to place these words on note cards and have the child identify them. The clinician will tell the child to say the words. Then the clinician will have the child use the words in a sentence.
Open up our book and we read our book. And when we're together, we flip the book and read all the pages all the way to the end. That's our book. Then we have cook. Have a nice big mixing bowl and we cook up spaghetti. Does your mom like to cook spaghetti?
Yeah.
Yes. Cook. All right. So you got point to book. Good job. Now can you point to cook? Doing a great job of pointing. Now, let's bring back the thing. Now, can you
I like
say,
to cook at home.
You do like to cook at home?
I help my mommy.
Oh, you're such a good helper.
Yeah.
All right, now can you say book?
Book.
Good. Now let's say cook.
Cook.
Good. Now we're going to use in a sentence. So, let's use book in a sentence.
The book is pretty.
Good. Now let's use cook in a sentence.
I like to cook.
Good job.
A plus mark will be given for a correct response. A minus will be given for an incorrect response. The total will be added up and then divided to give a percentage that can be used to track progress. Examples of reinforcement include positive reinforcement, such as stickers at the end of a good session, and verbal feedback, such as praise. If the child has trouble with a particular portion of the therapy, it is important to give feedback that will help the child succeed in that area next time. For example, if they have trouble with the minimal pairs, remind them of the definition of each word and point to the corresponding picture.
All right, now we're going to point to the word book.
Book.
Okay, now this is cook. Remember, cook was with the mixing bowl, make spaghetti.
Spaghetti.
Book is this. We open up the book and we read the book. We flip the pages.
Okay.
Now, point to book.
Book.
Good job, got it.
I'm smart.
You are smart.
If the client has trouble with the vocabulary aspect, going back to the manipulatives or pictures and an example sentence might help the child create one of their
Now
own.
use cook in a sentence.
I like to read cooks.
All right, now let's remember, book is something that we read. Cook is something that I cook to make spaghetti. So I would say, I cook spaghetti for dinner. Now you try.
I like to cook with my mom.
Good job.
Advantages include this treatment targets semantics and vocabulary at the same time. Also, because of the narrow focus, the child will not be overwhelmed by the amount of errors, but will be able to focus on one error at a time. It also gives a more holistic understanding of the words being targeted through the auditory, verbal, visual, and kinesthetic input. Disadvantages include that it only targets words that you are working on in that session, so it's hard to generalize to multiple targets. Also, this treatment only helps those who are highly unintelligible and whose phonological disorder is affecting their vocabulary. Additionally, words have to be specific enough to be able to provide concrete manipulatives to the client.